Hello, this is Lauren Buck, and this is the final presentation for the CM585 Addictions and Substance Abuse class. Following are the elements within this presentation. We'll begin by reviewing the case. Following are considerations and assessments used to further our understanding of the case. Afterwards, there's 4 DSM diagnosis ruleouts that are going to be identified and explored, and then the proposed diagnosis is discussed. The dimensions of severity and levels of care are also discussed and how they inform the treatment process. Relapse is addressed through the CNAPS model. Following are 2 of the modalities selected for this case, which is cognitive behavioral therapy and motivational interviewing. Of those 2, we will discuss the philosophy and definition, benefits and limitations, population, duration and roles, and risk and ethical cultural considerations. Lastly, we will overview the case and how everything is connected. For this project, I was assigned Robin's case. In full, Robin's case vendetta goes as follows. Robin is a 19-year-old college freshman at Ohio State University whose family is from the West Coast. She applies to various schools, hoping to get into private school. However, her grades and SAT scores were not the best. She was able to attend OSU due to her grandfather and mother both being graduates of OSU, and her minority status as a Native American. Robin was caught by her parents a few times throughout high school, drinking with friends, or attending parties where alcohol was present. She missed only a handful of days at school. However, when she did attend, she was often tired and distracted. She reports not liking the atmosphere of school and preferring to spend time with her friends. She had hoped that college would be more flexible and allow her time with friends, rather than stuck in class all day. Robin's roommate was a sophomore who introduced her to her friends, and Robin began to attend parties each weekend. She would spend most of her time at the house of one of the fraternities. She would drink and occasionally smoke marijuana. One weekend, she accepted a few hits from a marijuana pipe that was being passed around. She reports that she felt energized, unlike she was usually feeling when she smokes, but it didn't last long. She asked her roommate what kind of pot they were smoking, and she was told it was wet, which is pot laced with PCP. This freaked Robin out a bit, and she didn't want to get into drugs, so she avoided the parties for a few weeks. As finals were approaching, Robin realized that she needed to do some major studying if she was going to pass her classes. Her roommate caught her heading to the library to study one night and asked her if she wanted some Adderall, just to help her stay focused. Robin took it and reports that it helped her not only stay focused, but she was able to study much later than she had anticipated. She asked her roommate for some more and soon found herself taking them every day to help her study and concentrate. When she returned home for the winter break, her parents found it difficult to get Robin to engage in family activities, and she would often sleep all day. They suggested Robin see a doctor, who in turn recommended counseling for Robin when she returned to school. Robin is asking for a diagnosis of attention deficit hyperactivity disorder, ADHD, so she can get her medicine from the doctor. So, an overview of the case. Robin is a 19-year-old female. She is a freshman in an out-of-state college. She has a history of alcohol use and substance use. Her precipitating issue is that she took Adderall once to study and then began using daily. She recently went home and was unable to interact with her family, and she's currently seeking an ADHD diagnosis to obtain her own prescription for Adderall. She's also been referred to the counselor by the doctor. There were 5 considerations that I selected for Robin's case. The first was gender. Of the 2 gender considerations is that women's substance use may progress more quickly from the first use to addiction. The second is that women are likely to experience more intense withdrawals. The second consideration is Robin's age. Robin is 19 years old, and one thing to consider about her age is that the onset of mental illness may occur during this period. She's also attending college out of state. Another consideration that is age and environment related is the college climate. College students are at a high risk for abusing stimulants, and it should be noted that students lacking in healthy coping capabilities often use substances when experiencing elevated stress. The third consideration is her ethnicity. Robin is Native American, and her cultural identification is not explicitly discussed. However, it is important to be aware of the Native American culture without applying the cultural aspects to all Native Americans unless the client indicates that their personal views and values align with the traditional Native American culture. So it's important for Robin to share her personal values and beliefs. Other considerations was her history, specifically her history of alcohol use. Long-term effects that adolescent alcohol exposure can have on the adult brain function and the likelihood of later substances use and abuse is something to consider for Robin. She has a history of alcohol use and a more recent history of substance use, specifically marijuana, PCP, and amphetamines. There were three ethical considerations to consider derived from the American Counseling Association Code of Ethics. The first is B1B, respect for privacy. Robin disclosed that she was drinking underage and taking her roommate's prescription medication. It would be important to not inquire on the individuals that are providing substances unless it was considered beneficial to the counseling process. The second ethical consideration is B1C, respect for confidentiality. Robin's parents encouraged her to go to the doctor, who then referred her to a counselor. If Robin is on her parents' insurance policy, it would be important to protect Robin's confidential information in the case that her parents inquired on her treatment. The last ethical consideration is B3B, interdisciplinary teams. Robin's doctor referred her to the counselor. If the counselor had to collaborate with the doctor, it would be important to inform Robin of the information being shared and the purpose of sharing that information. Understanding the intersectionality of these factors and the role it plays in one's mental wellness is important to understand to fully assist the individual. There are various assessments that can be used for Robin's case. I selected the following two assessments to use. The first is the Adult Substance Use Survey. This survey assesses perceived alcohol and other substance use. One aspect of this assessment that would be important for Robin is that it includes a mental health screen by including questions that pertain to emotional or mood adjustment problems. This could be helpful as Robin's case indicates specific symptoms and moods that could be assessed through this survey. The second assessment is the Tobacco, Alcohol, Prescription Medication, and Other Substance Use tool. This tool can help the clinician understand the client's substance use within the past 12 months. Having Robin report the frequency of use for various substances would be helpful in understanding the frequency and extent of her use and could help inform her treatment. I identified 4 DSM diagnosis rollouts for Robin's case. I thought it would be important to first look at ADHD because this is what she was seeking a diagnosis for. Robin shows symptoms of inattention that are associated with ADHD. Her difficulty concentrating is impacting her academically. For Robin to meet the criteria for this diagnosis, her case information would require additional details about her behaviors. Additionally, ADHD begins in childhood, so Robin would need to recall her behaviors as a child, and these presentations would need to occur in more than one setting. Robin does appear to have a history of difficulty in school settings. However, her case does not indicate that she struggled with concentration in other settings, such as her home. The DSM-5 lists depressive disorders as a differential diagnosis. Difficulty concentrating is listed as a symptom that clients often present with. The prominent symptom that Robin's case discusses is her difficulty concentrating. Because this characteristic has been associated with a differential diagnosis of depressive disorders, this led me to believe or to look at major depressive disorder and substance medication-induced depressive disorders. A major depressive disorder diagnosis requires at least 5 symptoms in criteria A to be present for a 2-week period. Robin's case presents that she has experienced specific symptoms listed in criteria A, specifically depressed mood most of the day, diminished interest and pleasure, hypersomnia, loss of energy, decreased ability to concentrate. The time frame for the presentation of these symptoms would need to be established for Robin to meet the criteria for this disorder. These symptoms are influencing her life, however, it's unsure to what degree. Additionally, this criteria for this diagnosis states that the symptoms must not be attributable to the effects of a substance. The information provided in Robin's case does not confirm or disprove that her symptoms are impacted by substance use. A substance and medication-induced depressive disorder diagnosis differs from depressive disorders by the symptomology being influenced by substances or medications. For Robin to meet this criteria, it would be important to know in detail the relationship between her substance use and onset of symptoms. For example, is her depressed mood during or after use, and the persistence of symptoms. Additional information that is needed is the extent in which she was using alcohol, marijuana, and Adderall. With the information provided concerning Robin's substance use, this diagnosis does not appear to be the best suited for her mental health concerns. The last DSM diagnosis rule-out was stimulant withdrawal. A stimulant withdrawal diagnosis involves symptoms associated with ceasing stimulant use. Robin meets the criteria as described in the DSM-5. She has stopped using Adderall and appears to have 2 symptoms for criteria B, which are fatigue and hypersomnia. Additionally, Robin's symptoms are causing impairment in her ability to interact with her family. Criteria D indicates that the symptoms must not be attributable to other conditions or mental disorders. It's unclear if Robin's symptoms are associated with withdrawal from Adderall or if her symptoms are better classified by a different disorder. The proposed diagnosis for Robin is a stimulant use disorder with moderate severity, and it would be specific for amphetamine-type substances. She meets 5 of the criteria of criteria A. Criteria A1, the stimulant is often taken over a longer period than was intended. She took Adderall once and then began taking it daily. Criteria A2, there is a persistent desire to control stimulant use. It could be argued that her wanting to get a prescription is her wanting to, is her desire to use stimulants. Criteria A4, craving or strong desire to use the stimulant. She's seeking an ADHD diagnosis to get her own prescription, so 2 and 4 are both supported by the same ideology. Criteria A5 is recurrent stimulant use resulting in failure to fulfill a major role at home. She came home and was unable to interact with her family, so it could be argued that it is impacting her within her home setting. And then criteria A11 is withdrawal. The subcategory of that refers to stimulant withdrawal criteria, and she meets the criteria for that with fatigue and hypersomnia as her symptoms. So Robin does meet the stimulant use disorder criteria with moderate severity because she presents 5 symptoms. Because Robin is using a substance, it would be important to determine the severity of her use and select an appropriate level of care. The American Society of Addiction Medicine criteria, dimensions of severity, consist of 6 components. The first is acute intoxication and/or withdrawal potential. Robin is experiencing withdrawal and is seeking medication. Because of this, I selected moderate because Robin is indicating some difficulty tolerating and coping with withdrawal discomfort. The second component is biomedical conditions or complications. I selected 0 that she has no problem because she is fully functioning with a good ability to cope with physical discomfort and she is not presenting any biomedical signs or symptoms. The third component is emotional and behavioral conditions and complications. I selected moderate because symptoms are causing moderate difficulty in the role functioning within her home. The fourth component is treatment acceptance resistance. This is unknown because she has not received treatment. The fifth component is relapse potential. I also selected that this was unknown. She does have a history of abstaining from alcohol and marijuana for a 3-week time period. However, it's unaware of how long she's been abstinent from her amphetamine use. The last component is recovery environment. I selected mild because alcohol and drugs are obtainable in her environment. Additionally, support in her environment would need to be assessed in addition to her motivation and willingness to abstain or obtain a positive social support system. The dimensions of severity can help inform an appropriate level of care for Robin. 2 of the 6 dimensions are unknown, 2 are moderate, 1 is mild, and 1 is 0. Robin does not pose any medical difficulties, and 2 of the dimensions are unknown. The scoring for the dimension of severity suggests level 2 care, which is intensive outpatient. However, because some information is missing, a level 1 outpatient treatment facility would appear appropriate to address Robin's substance use. Considering that Robin is experiencing manageable withdrawal symptoms from Adderall, she could benefit from level 1 care. However, she may not be receptive to this treatment option. Outpatient care provides a space to interact and listen to others, which allows the client to see that they're not alone and can create a sense of community. It also provides education about the risk of using substances. In the case that Robin is not prepared to have level 1 treatment, individual counseling would most likely be the best fit for Robin's situation. Individual therapy could include psychotherapy about the risk of prescription medications, exploration of her history with substance use, assessment of her patterns of behavior, and implementation of abstinence contracts. Individual counseling can help Robin understand her situation in more depth and the benefits of referral treatment options. Psychoeducation, exploration of Robin's challenges, and utilization of contracts are elements of individual counseling that can help prepare Robin for level 1 care. If Robin was not improving her challenges or if her substance use increased, an appropriate level of care should be reassessed. One element that can be helpful to Robin's process to recovery and relapse prevention is the CNAPS model. The CNAPS model consists of 9 principles. Principles 1 and 2 would assess Robin's patterns of addiction and treatment. Principle 3 includes providing relapse education. The 4th principle consists of Robin and the counselor collaborating to identify warning signs for Robin's substance use. The 5th principle includes ranking warning signs and exploring management of these symptoms. The 6th principle includes reviewing the recovery plan. The 7th principle includes reviewing the skills learned to maintain sobriety and how to implement skills in the case that warning signs present themselves. The 8th principle entails involvement of significant others because support is considered a key component for relapse prevention, and Robin's support system is something to address considering she is attending college out of state. The last principle pertains to maintenance, which is addressed by a comprehensive follow-up plan. Components of cognitive behavioral therapy and motivational interviewing can both be applied to the CNAPS model. There are 2 goals that I selected for Robin's case. Each goal will include 2 interventions and then a discussion of why these interventions were selected. The first goal is to stop Robin's Adderall use and seeking. Intervention 1 would be to provide psychoeducation about the effects of pharmaceuticals and the consequences of taking medication that is not prescribed to her. Intervention 2 would be to develop an abstinence contract with Robin and process her feelings concerning the commitment. The purpose is that Robin's use of Adderall has been on a constant basis, and she has also linked positive effects of Adderall use. Therefore, her use of Adderall should be addressed. The first intervention would be to provide psychoeducation about Adderall, so Robin can be aware of the effects of the medication and consequences of taking unprescribed medication. The second intervention would allow there to be a contract between the counselor and Robin. Robin has a history of maintaining abstinence from alcohol and other substances. However, she may not view Adderall as a dangerous drug, such as she did when taking PCP, because it can be prescribed. Psychoeducation about controlled substances can help her understand the dangers of amphetamines and the contract can be used as a way to indicate problematic behaviors. For example, if Robin breaks the contract, this will indicate that she is having problematic substance use and may benefit from more intensive treatment. The second goal is to learn relapse preventative skills through cognitive behavioral therapy. The first intervention would be to provide education about CBT, such as therapeutic relationships, CBT ideologies, and concepts. The second intervention is to utilize CBT tools to identify stressful situations and current means of coping skills used, such as deciphering core beliefs. The purpose is that Robin is likely to benefit from understanding the relationship between her thoughts and behaviors. Providing information about the therapeutic modality can help her understand the objectives of this approach. Another intervention that can be applied to this goal is implementing one of the many CBT tools that can help Robin identify stressful situations that can cause stress. CBT can also be helpful for Robin concerning her relapse prevention. One cognitive behavioral approach to drug abuse is called relapse prevention, RP. RP focuses on the identification and prevention of high-risk situations, such as friends who use and places where substances are used. And this would be applied to Robin so that she would know when she is more likely to engage in substance use. Skills training, behavioral strategies, psychoeducation, and challenging Robin's expectations of perceived positive effects of use are both considered techniques of RP. Implementing these elements can benefit Robin through her counseling journey and beyond. The two treatment approaches that I selected for Robin's case are cognitive behavioral therapy, CBT, and motivational interviewing, MI. CBT is grounded in genetic and biological influences, increasing one's susceptibility of developing certain mental disorders. CBT has been beneficial in identifying maladaptive behaviors associated with addiction and abuse, and is considered an effective treatment for individuals struggling with prescription medication abuse or addiction. MI is grounded in the idea that the client explores what they want without the influence of the counselor. MI is a client-centered counseling approach that is used to motivate clients to change their destructive behaviors. There are several benefits and limitations to CBT and MI. CBT has been identified as effective for people with substance use disorder and has been applied to culturally diverse populations. One limitation of CBT is the lack of integration of clients' religious or spiritual beliefs. This is a factor that you should be cognizant of. Specifically for Robin, it would be important to understand her values and beliefs. MI has proven effective for individuals seeking treatment voluntarily and involuntarily. MI allows the client to come to their own conclusions about the pros and cons of their substance use, their openness to change, what change looks like for them, and how they wish to execute that change. MI promotes autonomy for the client to make changes in their substance use. Two limitations of MI that are relevant to Robin's case is the client's receptivity to change. If they are not motivated to change, they may not benefit from this modality. The second limitation is that MI does not emphasize the urgency for change. CBT and MI can be used together in individual counseling and also in group therapy. Presented is a comparison of CBT and MI and various elements. The top row is for CBT and the second row is for MI. Populations that can benefit from CBT are individuals suffering with anxiety disorders, depression, obsessive compulsive disorder, substance use disorders, phobias, eating disorders, and sleep disorders. Individuals can benefit from MI if they're suffering with anxiety disorders, depression, obsessive compulsive disorders, and substance use disorders. Both CBT and MI are classified as short-term therapies and can be implemented in group therapy. The counselor role for CBT is a demonstration of empathy, care, collaboration, optimism, and adaptation of therapeutic styles. The counselor role for MI is that the counselor must demonstrate high levels of empathy, reflective listening, and establish a strong bond with the client within a short amount of time. Client roles for CBT often give homework, and conduct experiments between sessions. These elements are helpful in determining the client's readiness to change because a client's willingness to change is needed for CBT to be effective. MI client roles consist of clients change when they are engaged in a therapeutic relationship in which the counselor is genuine and warm, expresses unconditional positive regard, and displays accurate empathy. Therefore, the client must be willing to be engaged in the therapeutic relationship. Presented are risk and ethical and cultural considerations for cognitive behavioral therapy and motivational interviewing. There are not many risks in using CBT, but one risk associated with CBT is discomfort. Clients may feel emotionally uncomfortable because CBT can cause one to explore painful emotions, experiences, and feelings. As mentioned earlier, one limitation of CBT pertains to ethical and cultural considerations. CBT fails to integrate the client's religious or spiritual beliefs, which can negatively impact the client who identifies as religious or spiritual. One risk of MI is the reliance on effective MI leaders. If the professional using MI is not effective, it can negatively impact the counseling experience for the client. One ethical and cultural consideration for MI are cultural assumptions. MI carries several cultural assumptions specifically concerning individual freedom and autonomy. Using MI in cultures where such assumptions may not hold true can create a challenge. However, being mindful of the individual's culture can help the counselor navigate this potential obstacle. Because of Robin's purpose for going to counseling, which is to seek an ADHD diagnosis to obtain her own prescription for Adderall, she is likely to be unaware of the severity of her substance use disorder. Assessments can help inform the appropriate level of care, and working through the CNAPS model can allow Robin to further understand her substance use and elements that can help her, for example, social support and coping skills. Furthermore, counseling, whether individual or group, that implements CBT and MI can benefit Robin. Motivational and cognitive interventions can be provided to enhance motivation for these alternative activities as behavior, while also working to decrease cognitions that enhance the likelihood of drug use. Utilizing MI can allow Robin to explore the pros and cons of her use and gauge her receptivity to wanting to change her behaviors. Based on her readiness to change, CBT can be implemented to further explore these behaviors. Other aspects that counseling can provide to her are psychoeducation about the consequences of using prescription medications, exploration of her relationship with substances, for example, why is she using substances, and collaborating with her to develop more effective coping skills.